No emergency lights, no crushing chest pain, no sudden warning to wake you up. Some of the deadliest heart attacks strike silently in the dark pre-sunrise hours. Long before most people start their day, deadly early morning heart attacks often come without symptoms, and the true hidden cause behind these unexplained cardiac emergencies lies entirely in your ordinary nightly pre-bed routine. Hollywood movies and mainstream television have completely misled generations of aging adults on how real-life heart trouble actually strikes. You can lie down in your bed at night feeling perfectly healthy, zero chest tightness, zero arm numbness, zero unusual fatigue or physical discomfort of any kind, and wake up the next morning with permanent heart damage, severe cardiac scar tissue, or even sudden fatal heart failure with absolutely no prior warning signs. Countless heart attack survivors I have treated confirm the same terrifying truth. They felt completely normal the entire night before their life-altering cardiac event, and never sensed a single red flag that danger was building inside their arteries. I have worked over 25 full years as a practicing cardiac surgeon, spending thousands of hours in hospital operating rooms. I have performed emergency heart surgeries in the earliest pre-dawn hours, working to reverse silent overnight heart damage patients never knew developed while they slept peacefully. I have reviewed tens of thousands of senior patient medical histories, tracked consistent clinical patterns across decades of surgical and clinical work, and I can state with unshakable certainty, these unannounced, symptom-free early morning cardiac emergencies almost never happen from random bad luck or unavoidable aging failure. They develop slowly and predictably over months and years, fueled entirely by tiny, repeated, harmless-seeming choices you make each night before turning off your lights and falling asleep. The biggest mistake older adults make with heart health is dismissing evening rituals as trivial, meaningless comfort habits. Most seniors never realize their exact dinner timing, late-night food choices, daily blood pressure medication schedule, bedroom temperature, nightly water intake, and even sleeping posture combine to create constant hidden strain on their cardiovascular system while unconscious and unable to compensate. The human body never fully shuts down when you fall asleep. Your heart and circulatory system simply switch into a low-power, vulnerable nighttime operating mode most people never learn about. Young, healthy adults with flexible blood vessels and strong hormonal protection see a 10 to 20% overnight blood pressure drop, slower resting heart rate, and relaxed arteries to enable vital overnight tissue repair, arterial cleansing, and cellular recovery. This natural nightly reset delivers essential heart maintenance that keeps the cardiovascular system strong and resilient for decades. But as your body ages, this delicate protective system grows far weaker and less reliable. Blood vessel walls gradually lose natural elasticity. Internal blood pressure regulation becomes slow and imprecise. Protective nighttime heart-stabilizing hormones decline year after year, and your body's margin for surviving minor cardiac strain shrinks drastically, all happening silently with zero obvious warning signs of rising risk. During daytime hours, your body activates dozens of powerful backup mechanisms to handle stress, blood pressure spikes, inflammation, and physical exertion. Your heart has multiple safety nets for daily stability, but nearly all these critical protective features power down overnight, leaving your heart and arteries with minimal support from midnight until 6 a.m. Long-term peer-reviewed studies from the American Heart Association confirm this 6-hour window carries the highest risk for silent heart attacks, transient ischemic attacks, and debilitating strokes in aging adults. Cardiac danger does not peak during busy afternoons, stressful work moments, or rush hour traffic. It peaks during quiet, unsupervised nighttime hours while you sleep, with no one present to spot subtle physical changes or early warnings. Every small choice you make 2 to 3 hours before bed directly shapes how much hidden pressure your heart endures through this deadly overnight window. Your dinner timing, meal heaviness, medication schedule, late-day water intake, and bedroom temperature all determine your heart's resting workload. One of the most common, underrated, and destructive cardiac risk factors I see in clinic is eating heavy, calorie-dense meals late in the evening. During routine consultations, most senior patients admit regularly eating full, rich dinners at 8 p.m., 9 p.m., or even 10 p.m., meals loaded with refined carbs, fatty red meats, creamy sauces, fried foods, and starchy sides. Many finish these large meals, rest on the couch for 1 or 2 hours, then head straight to bed expecting peaceful sleep. I understand this routine stems from busy schedules and lifelong family habits, but your cardiovascular system cannot distinguish convenient routine from dangerous physical strain. Every large, heavy meal triggers massive digestive blood flow surges, forcing the heart to pump faster and harder to meet sudden bodily demand. Systolic blood pressure elevates for hours after eating, and bloodstream triglycerides spike sharply 2 to 4 hours post-meal, creating thick, fatty blood that strains every artery. Combining severe digestive stress with sleep creates a devastating internal biological conflict. Your circulatory system is programmed to slow and repair overnight, yet your heart is forced to work overtime digesting late-night food. These opposing bodily needs clash all night long, and existing arterial stiffness, minor plaque buildup, or age-related vessel hardening amplifies internal pressure exponentially, causing undetectable hidden damage. Prominent research in the Journal of the American College of Cardiology links late heavy meals within 2 to 3 hours of bedtime to sustained overnight hypertension, heart-mimicking acid reflux, and drastically higher silent cardiovascular event risk during sleep. Nighttime reflux irritates cardiac nerve pathways, triggers artery spasms, and worsens unstable coronary plaque, creating perfect conditions for overnight clot formation and silent heart damage. You do not need extreme restrictive diets to eliminate this risk. Simply finish your largest, heaviest meal no later than 6 or 7 p.m. daily. If hungry later, stick to small, light snacks of lean protein and non-starchy vegetables, fully avoiding high-fat, dense foods that overwork your aging heart through rest hours. Never dismiss late evening dining as harmless. This repeated habit slowly erodes your heart's ability to withstand overnight pressure spikes and silent cardiac stress. Medication timing is another life-or-death detail millions of seniors overlook. Most aging adults rely on daily prescription medication to manage chronic hypertension, yet few realize pill timing determines overnight heart protection and vulnerability. Healthy human blood pressure follows a clear circadian rhythm, rising on waking, peaking mid-afternoon, and declining at night for cardiac rest and repair. But most older hypertension patients never experience this healthy nighttime drop. Their pressure stays elevated all night and surges violently pre-dawn, a dangerous little-known condition called nocturnal hypertension. This silent nighttime high blood pressure is far more deadly than daytime hypertension for aging hearts and arteries. Sleeping arteries adapt to low resting pressure, so sudden pre-dawn spikes irritate and crack unstable coronary plaque, triggering rapid clot formation and fully silent morning heart attacks with zero advance warning. Taking blood pressure medication only in the morning means peak effectiveness misses the critical overnight high-risk window entirely. Even a single missed dose leaves your cardiovascular system unprotected when it needs defense most. Landmark data from the Hygiene chronotherapy trial proves bedtime antihypertensive administration for eligible seniors drastically reduces silent heart attacks, strokes, and cardiac death risk. This simple timing adjustment is a powerful life-saving medical intervention. Every senior on blood pressure medication should consult their provider or cardiologist promptly to check if evening dosing fits their health profile. Never adjust dosage or timing without professional guidance. Countless preventable cardiac emergencies occur yearly because patients underestimate medication timing's critical role. In cardiology, timing is everything, and ignoring this principle creates constant overnight danger. Untreated obstructive sleep apnea is another massively underdiagnosed silent threat linked to fatal early morning heart attacks. Most people dismiss loud, irregular nighttime snoring as an annoying bedtime quirk, but after 25 years treating aging cardiac patients, I treat all inconsistent heavy snoring as a confirmed cardiac warning sign until testing proves otherwise. Johns Hopkins University researchers estimate over 30% of aging adults have obstructive sleep apnea, with most cases undiagnosed and untreated for decades. Unaware of cumulative nightly heart and artery damage, each apnea episode cuts off oxygen flow for 10 to 40 seconds or longer, repeating dozens of times hourly all night. Every sharp blood oxygen drop triggers an extreme bodily stress response, flooding the bloodstream with adrenaline and cortisol, spiking resting heart rate and blood pressure violently while you remain asleep. Your heart endures repeated traumatic shocks all night through 30 to 50 disruptive cycles across 8 hours of rest, creating immeasurable cumulative cardiovascular strain. Long-term studies confirm untreated sleep apnea doubles fatal heart attack risk, drastically raises atrial fibrillation and subsequent stroke risk, and accelerates arterial hardening and thickening year after year. Most seniors ignore clear apnea red flags for years until major cardiac injury occurs. Persistent morning headaches, unrelenting daily fatigue after full night's sleep, frequent nighttime urination, daily morning dry mouth, and sudden gasping awakenings are critical warning signs requiring immediate clinical sleep study evaluation. Heavy snorers and those with heart disease, hypertension, or stroke risk factors must complete apnea testing as mandatory preventive cardiac care. Consistent CPAP therapy delivers proven cardiovascular protection, lowering nighttime resting blood pressure, reducing arrhythmias, and cutting overnight cardiac complication risks significantly. Mild evening dehydration is a hidden nightly cardiac danger rarely explained in senior health content. Countless older adults stop drinking fluids mid-afternoon to avoid nighttime bathroom visits and midnight fall risks. This practical choice creates severe hidden overnight cardiovascular danger. Even mild nighttime dehydration thickens blood and increases viscosity, raising circulatory resistance drastically. Young flexible vessels compensate easily for temporary blood thickening, but aging plaque-narrowed arteries cannot adjust. Slow-moving concentrated blood through blocked pathways, paired with overnight low heart rate, zero movement, and arterial disease, creates perfect clot-forming conditions. This exact combination causes countless unexplained silent morning heart attacks and strokes. The solution is simple and sustainable. Drink 1 8-ounce glass of plain water before bed nightly, keep fresh water on your nightstand, and sip freely if thirsty overnight. You never need to sacrifice sleep safety to avoid dehydration-related cardiac clot risks. Small, consistent water adjustments eliminate this major hidden danger entirely. Bedroom temperature control is the fifth overlooked pre-bed variable impacting overnight cardiac safety. Most people adjust thermostats for personal comfort alone, unaware ambient temperature alters all-night heart workload. The cardiovascular system only functions optimally within a narrow temperature range. Temperatures outside this zone force aging hearts to work harder undetected. Rooms warmer than 72 degrees Fahrenheit trigger excess body heat release, constant vessel dilation, elevated resting heart rate, accelerated nighttime fluid loss and dehydration, and shortened deep restorative sleep needed for overnight heart repair and arterial cleansing. Rooms colder than 65 degrees Fahrenheit trigger defensive vessel constriction to preserve core heat, raising vascular resistance and sustained overnight blood pressure spikes that damage compromised coronary arteries and unstable plaque. The scientifically validated safe zone balancing quality sleep and cardiac protection is 65 to 72 degrees Fahrenheit. This thermal neutral state keeps arteries relaxed, heart rhythm steady, and maximizes deep recovery sleep nightly. Zero-cost thermostat adjustments deliver consistent overnight heart protection and lower silent cardiac event risk dramatically. Now you understand the 5 core bedtime threats driving deadly symptom-free early morning heart attacks. You can adopt a simple, life-protective nightly routine starting tonight. Finish your largest meal between 6 and 7 p.m. daily. Prioritize lean protein, fresh vegetables, and moderate complex carbs, while avoiding oversized fatty meals that overwork the sleeping heart. Check water intake and medication schedules around 7 p.m. and consult your doctor about evening hypertension dosing for better overnight protection. Maintain a calm relaxation window from 8 to 9 p.m. with gentle walks, quiet reading, or peaceful conversation to lower nervous system stress. Power down all bright screens well before bed to preserve melatonin and systemic relaxation. Prep your bedroom before 9 p.m. with optimal temperature settings and bedside water. Complete your routine and settle into bed by 10 p.m. for full overnight cardiac repair. Snorers and apnea suspects should sleep on their side to reduce airway blockage while awaiting formal testing. After 25 years in emergency heart surgery treating thousands of nighttime cardiac patients, I have witnessed countless preventable heart injuries from unrecognized bedtime habit damage. Most severe cardiac complications stem not from bad luck, genetics, or natural aging, but from missing preventive health knowledge and decades of repeated harmless-seeming nightly routines that slowly degrade cardiovascular health. You now hold this life-saving knowledge and can break this dangerous cycle starting tonight. Never delay these simple adjustments for future appointments or later dates. Meaningful heart protection begins with your next bedtime routine. Follow these actionable steps consistently. Eat main meals early. Consult your doctor on evening medication dosing. Complete sleep apnea testing for snoring and morning fatigue. Maintain steady pre-bed hydration, and keep your bedroom at a heart-safe temperature. Most older viewers recognize these risky habits in their own routine. The key difference today is you understand hidden dangers and possess clear fixes for long-term heart protection. Share this vital guidance with other seniors unaware of bedtime cardiac risks. Before closing, I invite you to comment your age and the first bedtime habit you will adjust to protect your cardiovascular health. Subscribe for senior-focused, evidence-based heart health guidance to preserve cardiac function, maintain independence, and avoid preventable hospital visits with age. Disclaimer: this video reflects general cardiovascular research and decades of clinical surgical experience. It does not replace personalized professional medical care. Never adjust prescription medication schedules or dosages without your doctor's explicit approval. Care deeply for your hardworking heart that functions tirelessly every minute of every day and night. Small, consistent nightly changes create low-stress bodily conditions to keep your heart strong, healthy, and functional for years to come.